In this video, I'm going to be demonstrating the procedural steps for taking oral liquid medication, applying topical medication to a patient, and then finally applying transdermal patch to a patient. So I'm going to start at the top for administering oral liquid medication. First, I'm going to access the medication administration record and make sure I have the correct patient and make sure it's the right dose and the right drug. Next, if necessary, I'm going to shake the liquid medication. Now, if it is a multi-dose administration liquid, I am going to place the medication administration cap in front of me to make sure that I measure the correct amount. Then turn over the container to measure into the container, placing my palm against the medication label, and then I will be measuring the liquid according to the meniscus. Then, after I have poured the correct amount of medication, I will recap. Now, if this is a single unit dose, I will not need to do those steps. Next, I will take the medication administration record and the medication to bedside. First, I will identify self and perform hand hygiene. Then I will access the medication administration record, and I will use two forms of identifying information to identify the patient to ensure it's the right medication, the right drug, and the right dose. Next, I will ask the patient if they have any allergies. If they do not to this medication, I will proceed. Next, I'm going to give the patient the medication for them to take, and while they take it, I'm going to be staying at bedside. If they decide to not take the medication, I will discard. Next, moving on to topical administration of the medication. First, I will identify myself and perform hand hygiene. Next, I will access the medication administration record and do two forms of identification with the patient to make sure it's the right drug, the right patient, and the right dose. Then I will ask the patient if they have any allergies to any medication. If they do not, I will proceed. Using a gloved fingertip, I will remove the medication and apply it to that gloved fingertip. I will apply it to the patient's clean, dry, and intact skin. And if it is a multi-use, I will recap it. If not, I will discard. Finally, moving on to applying transdermal medication patch. I will go into the room, identify myself, and perform hand hygiene. Next, I will access the medication administration record and identify the patient using two forms of identification to ensure it's the right patient, the right drug, and the right dose. I will also check to see if they have any allergies. If they do not to this medication, I will proceed. Next, I will remove the patch from the patient's skin and discard. Then I will gently wipe the skin with a wipe to cleanse it. Next, I will remove the medication patch from its wrapping, only touching the outside of the patch. Next, I will apply the patch to clean, dry, and intact skin, and I will apply it and holding on to the skin, and I will be doing that for 10 seconds. Thank you.